Tonight, more than 300 Americans are back on U.S. soil now after being evacuated from a quarantine cruise ship docked in Japan.
The evacuees were passengers on board the Diamond Princess, where more than 350 confirmed coronavirus cases were reported on board that ship, including 46 Americans. They are currently being treated in Japan. Now, the evacuees were flown back to the United States on 2 government-chartered planes, and we've now learned 14 people on board those planes tested positive for the coronavirus. However, the CDC has not included these numbers in their persons under investigation national count, which remains at 15.
Our chief health editor, Dr. Partha Nandi, joining us now to explain why, Doc.
So, Glenda, the number of American positive cases remain at 15, and that's because the CDC considers these 14 evacuees as, quote-unquote, presumptive positive cases. You see, these people were tested in Japan and about 2 or 3 days before boarding planes to fly home. And that's not to say that the testing was done incorrectly or was inaccurate. It's just that the CDC is following its own procedures, which means that these 14 folks need to be retested with the CDC's approved testing kits. So specimens have been taken, and we're just waiting to hear the results.
So, Doc, will all of them be actually quarantined for those 14 days?
Yes, despite spending almost 2 weeks on the ship in quarantine, they're quarantined here again in the U.S. for a total of 14 days. And all of them were taken to military bases, all 14 who tested positive. And this is important, were kept isolated from those who tested negative on the flight home, and they continue to be kept in isolation while being treated at the military bases.
So, Dr. Nandi, China publishing a paper with details on confirmed cases of this coronavirus. So what can you share about that?
So, Glenda, this information is extremely useful because it helps us get a clearer picture of how this COVID-19 is affecting humans. Now, the paper published contains data from over 44,000 confirmed cases of this deadly virus, so a lot of cases. The good news is that over 80% of patients end up with a mild form of this respiratory virus and they recover. But in 14% of cases, those, if inflicted, really ended up with a severe form of COVID-19, which included pneumonia and shortness of breath, and 5% of cases become critical. Patients can face respiratory failure, multi-organ failure, and septic shock. All this is very dangerous. As for the death rate, 2% of cases were reported to be fatal, and fatalities generally involved older people. Now, looking at the positive side, this dangerous respiratory virus appears to not be as deadly as SARS or MERS that happened several years ago, and hopefully the confirmed case numbers will continue to decline in China, which is great news. So we're all looking forward to getting more details.
That's the bit of good news.
Yes.
All right, Dr. Nandi, thank you for keeping us updated.
Of course.
And if you have a question or a health concern for the doctor, you can email him, Dr. Nandi at AskDrNandi.com, or be sure to send it to us on Facebook or Twitter.